Thalassemia is
Rayan.
also inherited. Like the sickle cell anemia, it causes your body to have less hemoglobin than normal. This will cause fatigue. Mild thalassemia doesn't need treatment, but if you have severe thalassemia, you might need to visit a doctor.
Next slide.
Yes. Symptoms differ from each type of thalassemia. It may include fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, and dark urine. Some people develop thalassemia at birth, but others develop them during their first 2 years of life. Next slide. Make an appointment with your doctor when you have one of the symptoms. Thalassemia is inherited. It is caused by mutations in the DNA of cells that make hemoglobin, and these mutations come from parents to children. There are two chains for hemoglobin, alpha and beta chains, that are affected by hemoglobin. The production of either chains are reduced. This will cause one of the two types of thalassemia, alpha-thalassemia or beta-thalassemia. In alpha-thalassemia, the severity of thalassemia depends on how many gene mutations inherited from your parents. The more mutated genes, the more severe your thalassemia. In beta-thalassemia, the severity of thalassemia you have depends on which part of the hemoglobin molecule is affected.
Okay, so as Rayan said, the number of genes that mutate of the hemoglobin DNA that determines the severity of the thalassemia that will happen, which is if one mutated genes in the alpha hemoglobin chain gets mutated, you'll have no signs or symptoms of thalassemia, but you are carrier of the disease and can pass it on to the children. So if there's one mutated gene, there's no danger to you, and you can carry it on to the children, and the children can be affected or can be harmed by this mutation. If two mutated genes in the alpha chain occur, you will show signs and symptoms, but they will be mild. The condition might be called alpha-thalassemia trait. If three mutated genes, the signs and symptoms will be moderate to severe. Inheriting four mutated genes is very rare, and if it does happen, it will show up in the baby straight away, and a lot of people don't make it out of hemoglobin chain. Beta thalassemia is when two genes are involved in making the beta hemoglobin chain. Beta hemoglobin chain. You get one from each parent. If you inherit one mutated gene, you'll have mild signs and symptoms. This condition is called thalassemia minor or beta thalassemia. So that alpha thalassemia is the more important chain, let's say. Beta is not as important. I mean, this is important, but still. Two mutated beta thalassemia genes, your signs and symptoms will be moderate to severe. This condition is called thalassemia major or Cooley anemia. Babies born with two defective genes usually are healthy at birth, but develop signs and symptoms within the first 2 years of life. A milder form of two mutated genes can result, called thalassemia intermediate, also results from two mutated genes. Okay, what are risk factors of developing thalassemia? Is family history of thalassemia, parents passing down to children, genes, you know the story. Certain ancestry, if the ancestors, if there's the races and ancestry that thalassemia occurs on more often, such as African Americans and people in the Mediterranean and Southeast Asian descent. Complications: what could happen if you develop severe thalassemia? Iron overload. People with thalassemia can get too much iron in their bodies, either from the disease or from frequent blood transfusions. Too much iron can result in damage to your heart, liver, and endocrine system, which includes hormone-producing glands that regulate processes throughout your body. Well, basically, the hemoglobin cannot. There's a problem with the hemoglobin. The iron that you have in your body cannot be used properly in your cells, in your red blood cells, and you end up with the iron overload, which is a big problem. Infections. You can't. The cells in your body do not access oxygen as properly. This also includes your immune system, so you are more prone to infections. You're at more risk of infection. This is especially true if you had your spleen removed. What's the spleen? Does anybody know?
Spleen is the part of the immune system.
There it is. If your spleen is removed, you are more at risk for an infection. Okay. On other complications of this disease, bone deformities. If you have thalassemia, your bone marrow expands, which causes your bones to widen. Basically, hemoglobin is made in the bone marrow, as we all know. And if there's a problem, your bone marrow expands and your bones widen. And this results in abnormal bone structures, especially in your face and skull. Bone marrow expansion can also make bones thin and brittle, increase the chance of broken bone. Basically, thalassemia can cause bone problems because of the genetics. An enlarged spleen. Okay, there's the answer that I was looking for. As Rayan said, the spleen is part of your immune system and it helps fight infections. And when you have such, and if you have old damaged blood cells that thalassemia and other anemia diseases often cause, you will have a problem in your spleen. It will be enlarged because it's being overworked. Thalassemia is often accompanied by the structure of a large number of red blood cells. This causes your spleen to be enlarged and work harder than normal. Yes. Okay. So this makes more sense. When you have thalassemia or other types of anemias that causes bad red blood cells or damaged red blood cells in your blood system, your spleen has to work extra hard to remove all of these from your blood system or attack these because these are not supposed to be there. An enlarged spleen can make anemia worse, and it can produce the life of transfused red blood cells. If your spleen grows too big, your doctor might suggest surgery to remove it. Ouch. Slowed growth rates. Anemia can both slow a child's growth. Your cells are not functioning properly. They don't get oxygen. You don't grow properly. Heart problems. Congestive heart failure and abnormal heart rhythm can be associated with severe thalassemia. Prevention. In most cases, you can't prevent thalassemia. If you have thalassemia, if you carry thalassemia genes, consider taking genetic counselor, talking with a genetic counselor or guidance if you want to have children. Your genes are bad, you need to get help. There's a form of assisted reproduction technology diagnosis, which screens an embryo at its early stage in genetic mutations combined with vitro fertilization. Basically, they're just trying to notice this disease before the baby grows in the womb. They hemoglobin genes, basically, from a healthy baby. The procedure involves retrieving mature eggs and fertilizing them with the sperm in a dish in a laboratory. The embryos are tested for defective genes, and only those without genetic defects are implanted into the uterus.